It's been 9 months since the world is under the seizure of COVID-19. Back in December 2019, coronavirus aka COVID-19 had emerged in China at first, transported with humans throughout the world, and over the time span of 4 months, it became the world pandemic. The purpose of this activity is to analyze how COVID 19 is affecting the life plans and activities of humans all around the world. Also, what are the basic government initiatives and how the societies, the public react to those initiatives? Because we are not alone in this. I'm your host Mehran Iqbal, and you are watching YARRDS Interviews. We have a panel of young, vibrant scholars and activists around the globe. Miss Anne Petke from United States is the first. She is a philanthropist and social worker. She has a decade plus experience as social worker in non-profit organization. She is a recipient of President's Volunteer Service Award 2019, also spoke in numerous national and international conferences. She currently works for the Food Bank for New York City, the city's largest hunger relief organization. Second panelist is Ms. Danielia Huxley Reeses, a 25-year-old young professional which is passionate about creating social impact in the world. Her past experiences of humanitarian work includes in Brazil, Greece, India, and Mozambique. Postgraduated in humanitarian action and cooperation for development of project management, she is consultant for small NGOs in Portugal and Tanzania, where she designed and improved social projects in different sectors. Ms. Sarah Rubens from Germany is our third panelist, a 30-year-old young professional completing her master's and working as a research assistant in university. Our final panelist is Mr. Kim De-young, a young professional pursuing his graduate degree in Korean University with majors in political science and international relations. Envisioned to be a diplomat that worked for the peaceful integration of Korean Peninsula. He speaks 4 different languages. He is president of various student bodies. His area of interest is world history and Korean diaspora. Therefore, he founded a platform named Korean History Platform for People. Let's start with a very basic question: how our panelist has been coping with the COVID-19 themselves and what impact it has caused to their life. Talking about me personally, I did not find it hard to cope with the virus itself. Wearing masks, using hand sanitizers, washing hands 3 to 4 times a day helped me a lot in it. The harder part was to cope with the psychological impact. Quarantined for 3 to 4 months at home wasn't so easy, but now that phase has also passed eventually. As in Pakistan, we are allowed to dine in restaurants, have small gatherings, entertain our guests, etc. And regarding my professional goals, I had planned to get PhD admission in universities abroad as I recently completed my master's, but due to this pandemic, I delayed my PhD. And to cope with my educational and professional goals, I had been writing articles and blogs and keep writing articles and blogs and took training and a workshop online.
I live about a mile and a half from Elmhurst Hospital, which was in the national news for weeks as healthcare workers there were so overwhelmed with cases. And at one point from our apartment, you could hear ambulance sirens at almost any time of day or night, which was really eerie. I've personally been very, very fortunate as I live with my fiance and we were both relatively young and healthy and we're both able to keep our jobs. He's a professor, so he transitioned to teaching virtually online. And I work for the Food Bank for New York City, which is the largest nonprofit organization fighting poverty and food insecurity in New York. So my colleagues and I were designated as essential workers from the start. Both of our families have stayed healthy, and we haven't had to worry about where our rents or our medical coverage will come from. So while this has been a scary time to live through for everyone here, I've been very lucky and have not been as harshly impacted as so many others. I do know many friends who've been sick, though, and several friends who have lost neighbors or family members to the pandemic. I've been able to do a lot of my work remotely from home. Normally here in the city, I'd be commuting on the subway every day. I've lived here 10 years and I've never owned a car. But now I haven't ridden the train or a bus for over 4 months since my main office shut down at the end of March. I haven't left the city since the state of emergency was declared, and have really only been traveling on foot or on my bike when I need to go out. I've rarely left the radius of the few blocks around my apartment.
The moment that the government declared emergency state, I was doing a sustainability project to a city hall, and the project were cancelled because of the pandemic. They just allowed projects related to the pandemic. So I was living alone at that moment, and I decided to come back to my parents' home. It wasn't easy, that decision, but then because I was doing 2 post-graduations at the same time, in humanitarian action and international development, it was good to focus on my studies. So it hadn't that negative impact on me. At the moment, the things in Portugal are getting much better. People can go outside, and for me, for example, I'm getting out for meetings, dinners, and I feel completely safe outside. All the places are following the rules, and people too.
Well, the COVID-19 outbreak has resulted in severe changes to my plan of 2020. If all went according to schedule, I should have been in Beijing earlier this summer, exploring the ancient city with its history. Also, I should be in Washington, D.C. or New York visiting prominent think tanks, the capital, political institutions with other Korean students. And also, being a president in several clubs, I would be preparing to pass on my affairs to my successor. But truthfully, compared to my friends here and abroad, my troubles are trivial. I am privileged enough to live in a household with stable income while enjoying the bountiful time that the pandemic has had a hand in providing. I was able to use my spare time meeting people, attending web seminars, reading books, and communicating with students out of the country.
Risk patient because I have heavy asthmatics. That's why I was staying at home most of the time since the news spoke of Corona, and later suggested people to stay at home and not go out and not meeting big groups. And that was because I suffer a lot from asthmatics, even if no virus is going around. So it's because of allergies and sometimes even doing sports or just having a bad day, and then I run out of breath. And in the very beginning, I was really scared of COVID-19 due to these reasons, because I thought if I might get COVID-19, it might be really heavy for me and that I suffer a lot from it. That's why I stayed home all the time. Just my family was shopping outside and brought me the food. My husband was the only one who always left the house, and I was staying here because of my study program. I could do everything online from home. I didn't have to leave the house. That was good in this case. But I was kind of bored. I missed social contacts, I missed friends, I missed my family, and I guess the worst was missing my grandfather, because he is 87 years old and also a risk patient, and that's why I didn't see him either for many weeks, and usually we see each other once a week. Yeah, about. I guess these were the biggest impacts on me. As I said, I'm staying home most of the time. I just started meeting some friends a few weeks ago, not so long ago, and I try to meet really small groups. I use hand disinfection whenever I go outside, and I have to go outside sometimes. I wash my hands more often than usually, and really long. I heard of a rule that you have to sing happy birthday twice, and then the time is long enough for washing your hands. And yes, as I said, I'm staying at home. I'm just meeting my parents because they are living in the same house, and my husband all the time. And I have one friend who I am always walking with, my dog. And she was the only contact I had during, how should I call it? The heavy time of not going out. I guess it's a bit more open now.
Moving on, let's ask our panelists about the basic government initiatives that government has took to deal with the pandemic. I live in Pakistan, so in Pakistan our government imposed smart lockdown at first and put halt on international national flights and on tourist spots. Smart lockdown refers to the shops that are necessary for the daily routine will remain open, such as bakery, general stores, livestock shops, etc. When the number of infected or deceased people increased, the strictness of lockdown was also increased, and vice versa.
I'm really grateful that here in New York, we're in a very liberal part of our country, and Governor Cuomo provided really strong leadership on the COVID-19 outbreak from the start. He held public press conferences every single day for 108 days, including the weekends, and I would watch him speak online every day to hear the latest numbers. Everyone would know the number of deaths, the number of hospitalizations, and where we were on that growing curve. It was a drastic difference from the situation at the national level in the US, where there was no meaningful leadership, no meaningful plan, and very little trust in the information being distributed. My organization, we have stayed running and have expanded our programs to make meal deliveries to those who are homebound and can't come out to receive meals in person. We've held emergency pop-up distributions across the city to bring extra food to the neighborhoods most impacted by COVID. And we've been really grateful that our organization has had so many generous donors and volunteers to help us during this time to make sure we can continue these programs. Something else we are seeing is that about a third of the people coming to us right now are people who have never needed free food programs before, who've never had to worry about food insecurity in their lives until the COVID outbreak, when they've suddenly lost their jobs or had their work hours reduced or faced unexpected medical expenses. So they're navigating these government systems for the very first time and trying to find answers on how to sign up for benefits for their families. And many of them feel uncomfortable asking for help. So we try to make sure everyone feels comfortable coming to us, that everyone is welcome. You don't need to prove your income or your immigration status or provide any paperwork. If you need a meal for your family, you can come get one from us. We know that anyone can find themselves in this position overnight. Through my work, I see firsthand the huge impacts this outbreak has had on everyone in my city, especially on those who are already struggling in so many ways. We are a city of 8 million people, and of those, more than 1 million are facing food insecurity even in normal times and don't always know where their next meal is coming from. Even in a normal year, my organization distributes 56 million free meals through our network of soup kitchens and pantries across the city. And this year, we've seen that need more than double in a lot of areas. Since schools closed on March 15th in New York, it's also been very difficult for many parents to continue working when they now have to care for their children at home as well. Support systems we took for granted in our society are no longer options for a lot of people.
Portugal was one of the first European countries that declared emergency before having a single case. and that led the country to control most of the cases and prepare people for the following months. The country were divided. Few people thought that the country were exaggerating with the measures. The other ones thought it was too late to do that because it will come hardly in our country and we don't have all the materials and the staff for control the pandemic. But then when the cases start coming, the hospitals, even with less material than it should have, control the situation. Another very well-known measure that was on international news were with migrants and asylum seekers. The Portuguese government has said that all migrants and asylum seekers currently living in Portugal were able to be treated as permanent residents during the COVID-19 pandemic. And they had access to healthcare, welfare benefits, bank and all the services. And they just needed to show the ongoing residency request.
So, South Korea has built hundreds of screening clinics and ensured adequate supply of tests. Social distancing is encouraged, though mostly enforced in religious services, karaoke rooms. So, they're kind of closed down right now. Our health system is centered on hospital-based care, while the government purchased personal protective equipment and built temporary hospitals to increase capacity.
Or what I know from the news basically is at first we should all stay at home, even people who had to go to work. If they were able to work in a home office, then they should stay at home at all. You should not have any contact that is not necessary. You may not go to the doctor if you have some symptoms like an infection, like a cold or a flu, because it could be COVID. And then you had to call the doctor first, and if he or she had a suspicion, then they would send you to the Gesundheitsamt, I don't know how to translate, from the Kreis Siegen-Wittgenstein, and they did a COVID-19 test. In general, I know that you should keep distance from other people, at least 1.5 meters. Then, so I don't know when exactly, but then we had to wear masks in public places, so like public transport or in supermarkets. Nearly everywhere you meet other people and you are inside, or on markets outside also wear masks. Still avoid contact that doesn't have to be. I'm thinking you may not meet more than 10 people. You may not be in a group of more than 10 people on the outside. And I guess before this they were less people, but I can't remember the exact numbers. Then big parties and celebrations, festivals were not allowed anymore. You may not marry and celebrate your marriage. Quite a time you should not go to the church. Every big event with more than, I guess, 30 people. Meanwhile, you are allowed to celebrate private parties with about 50 or 100, but I'm not sure. I guess that's a big problem because these laws and rules always change week after week, and they announce new rules, but I can't remember the real numbers, so I'm not sure with this.
So, Let's discuss how effective these initiatives has been proved. In Pakistan, government initiative has been proved to be very effective as world is facing second wave of COVID-19 and there are countries like US, Brazil and South Asia, our neighboring India, that is still dealing with the first wave of COVID-19 with a huge number of deceased and infected people. Meanwhile, Pakistan is going back to the normal gradually, and so far it seems immune to the second wave of pandemic.
Unfortunately, even here in New York, it took a long time for people to start wearing face masks. In the early weeks of the pandemic, there was so much concern about people hoarding PPE supplies and medical workers not having access to enough equipment that civilians were actively discouraged from buying or wearing masks, with government sending the message that it wouldn't make a difference. It wasn't until April 17th that face coverings finally became mandatory in New York City, but we could have saved so many more lives had that not been such conflicting messaging at the beginning of the outbreak. It seemed almost a little too good to believe when we saw the infection numbers begin to plateau and then finally begin to come down again. New York City began the phases of reopening in June, and Governor Cuomo was really smart about New York's reopening plan, taking it step by step at 2-week intervals, communicating every day on what each step of reopening would look like and how those numbers were coming in. And all this data was household information. You could watch it online every day, and everyone knew.
One of the first countries declaring emergency before having cases helped us a lot to prepare the hospitals and the staff. So, of course, we have more numbers that we wanted to, but it's something that we could not control. But I think that measure was good comparing to another European countries, for example, Spain or Italy. That was horrible what happened there. So at the end it was a very successful measure.
Korea flattened the curve without closing businesses or forcing people to stay at home. Our testing capacity reaches up to 20,000 tests per day, and we have less than 100 cases per day, which is mostly imported.
I think they were effective, especially staying at home at the very beginning and not meeting in groups. I guess in the beginning you were just allowed to meet 2 people and meeting your household, so people living in one house. Then later, people from 2 households, and I guess these were really effective. But then later, when people started to wear masks, I read a lot of articles or saw reports that these masks are not so secure for people. Like you nevertheless will breathe some infectious air if there is an infection in the air. It just saves other people for your own virus if you sneeze or something. And then I had a feeling that people didn't care anymore about keeping the distance, 1.5 meters. Now they are running straight at you and next to you and don't care anymore about distance because they think they have a mask and this will help enough. But I guess that isn't true.
It is also important to discuss how society has reacted to the government initiatives. In Pakistan, our society is, I want to take liberty and say, is not mature enough. With the continuous warning of the government and lockdown, there were people that took time to understand the uncertainty and complexity of the situation. There were conspiracy theories roaming in the societies and widely discussed in the gathering that whether the COVID-19 is Chinese propaganda or some American news strategy. Rather, the vaccine contains something suspicious or a science fiction mind controlling chip. There were few that took this scenario and precautionary measures, but most people are not trying to follow the government SOPs completely. But with the continuous government efforts and with the help of social influencer, the government had controlled the situation to the most extent.
When the New York pause stay-at-home order went into effect on March 22nd and our main administrative offices in downtown Manhattan closed, we all thought it would be a temporary thing. A lot of us left our stuff at our desks, never guessing that it would be so many months before we came back. Every few weeks, it felt like the outbreak would reach some new stage. First, people were skeptical, then they got really scared. Then every time we adjusted to another strange version of normal, things would get worse again. It felt like there was no calendar anymore, nothing to look ahead to that was for sure, as everything was on hold. Like life could just be this way forever now, maybe, with our city permanently closed down. Now we've entered phase 4, where a lot of people are back to work, but some things like indoor bars and restaurants, movie theaters, malls, gyms are still closed indefinitely, and it's still really uncertain how the school system will operate in the fall. My office is tentatively planning to reopen in October, but until then, we'll continue working from home as much as possible, and we'll continue our emergency work as there are still so many people who will feel these impacts for so many months to come. In the last few weeks, I've gradually started seeing a few local friends again in socially distanced settings. It feels sort of crazy to see actual people again. Riding our bikes, taking walks in the park, eating together outdoors. The city has issued permits to allow restaurants to take over sidewalks and streets for outdoor tables. So suddenly we have a whole city of sidewalk cafes, which I hope will be one trend that does continue even past the pandemic.
We were mostly critical of the government not blocking people from China, as our cases increased to be second in the world at that time. But criticism died down as Korea managed to contain the pandemic from spreading further, and other countries worsened as time went along. Conservatives still grumble about the measures being less than effective, but mostly it seems that the public is somewhat satisfied with how Korea is coping with the pandemic.
Now I want to ask my panelists about the impact of COVID-19 on their national, international policies, about the private schools that has gone online, private jobs, what impact that it has caused to the greater society. Talking about Pakistan, I'll discuss about the schools. It took a long time for school and colleges to establish a mechanism of online classes. Higher educational institutions have done this thing earlier, but for the children and young boys it was not very effective and handy substitute to take online classes. Due to the network connection or due to the availability of devices in the urban areas, in the rural areas, due to the availability of the devices and network in the rural areas, it was hard for students and for the family to keep it up with this substitute.
It's easy to get complacent as people start coming out again, but there's still so much uncertainty about what will happen in the fall. We went through such a terrible period here in New York City, and it's so hard to see that the rest of our country didn't learn the lesson from us. For so many months, COVID was seen as something that was only impacting cities with high population densities or only impacting states on the coasts. But now it's everywhere. And we're reliving all the same mistakes again in places like Florida and Arizona and Texas, where deaths are now rising every day again. New York has gone from the highest infection rate to the lowest infection rate in the country. And now visitors coming from most other states are required to quarantine for 2 weeks upon arriving here to prevent another outbreak brought to us from somewhere else.
About education and the private jobs. The education came first to online classes, and I had that experience during my post-graduations. It was both presential and then in 1-2 weeks maximum they turn all online, and that was finished both post-graduations online and with exams and tests and group works, and it was fine. The universities were prepared and fast they handled the situation. Of course, like, we have more fragile communities that don't even have a single computer, a private computer or internet in their home. That's something that at these times it seems difficult to imagine, but we had much more than we could imagine. But we had the support of the communities and the government. They did a lot of campaigns in schools and universities for donations of computers, of money, to help the ones that couldn't have access to that, and even to arrange private rooms or places that they keep studying without losing this year. Of course, at the moment, not all the students have access to computers or to the classes, but even on the national TV channel, the few classes were giving live. So at the TVs, they were passing a few times a day. And the problem, and the government is still trying to mitigate the problem for the next year. That will be another big challenge. Jobs itself, a lot of people got in layoff or get fired, and we know that a big economic crisis are arriving, and few families are already feeling it. For example, Portugal has a big part of the economy and tourism, and the boost, it became giant in the last years. And because of the pandemic, most of the flights are cancelled, or the flights are much less than usually. And Portugal is being one of the countries for mandatory quarantine, so more than 80% of our reservations in hotels and local housing were cancelled, and we'll feel it a lot in the winter, next years actually. So it will not be easy. The government still don't know how we'll do it. There's a lot of people without working, and it's always been difficult to find a job in Portugal, or to get a good salary, and the rents became increased a lot because of the boost of the tourism. So now it will be more difficult to fight this, but we are waiting for the measures.
Anti-Chinese sentiment has risen, as well as disbelief at failures in so-called first world countries. Relations with Japan has not improved at all, what with visa cancelling measures done to Koreans. Exchange programs in the region, such as Campus Asia, kind of like the Erasmus program, but between Korea, Japan, and China, have been either cancelled or delayed, slowly cutting off interaction between countries and youth. What little face-to-face communication that had existed in universities has dwindled even further. As for education for school children or freshmen, they haven't had much chance to meet their peers, which is debilitating in terms of socializing with others. Then again, perhaps this is a chance to discover what pivotal aspects of education is truly necessary for students, or what is unnecessary. Private jobs are on the decline if there weren't so little available, what with the ongoing academic recession already. No job offers, and companies are experimenting with how many employees they need to continue their businesses. Things aren't looking bright at all in terms of economy. I have been hearing a lot about how countries have been treating foreigners, not providing visas, and etc. While we should all be wary of imported cases and the pandemic traveling across borders, perhaps nations shouldn't discriminate against foreigners who have permanent residency.
I'm not so sure if I know much about the foreign countries, I know, for example, that in Sweden they tried to keep daily life going as long as possible and did not do so many restrictions, because they said that if they just let COVID-19 come, then maybe many people will get immune soon, so that this virus will not infect so many people. But I don't know if they went on like this all the time. And then the other thing I know is that in Italy and in Spain and in France, cases were really serious because they had too many people getting ill at the same time, and then their emergency hospital places were overloaded and they didn't have enough space for all the people and couldn't take anyone to the breathing machines, and many people died there. Really sad. And I know that some of the surround countries, next countries to Germany, sent some people to Germany because we still had some beds and machines. Yeah. And I know that in America, Trump said ridiculous things like people should drink or maybe get the disinfection stuff with I don't know how to call it. He said some stupid things. And he was really loose with his instructions. So I guess the COVID cases there grew again. And now he said, okay, maybe you should wear a mask. But before this, he wanted to loosen the restrictions. There were other aspects like school and job. I know that many mini-jobber lose their jobs because, for example, restaurants, bars, disco, they had nothing to do anymore. So all people who had just mini-jobs didn't have work anymore. And school didn't take place at all. So all the pupils or students were at home. They had to get home teaching by their parents, and then really late schools opened again. In Germany it was county-wise. They had different regulations, and I guess at the beginning they sent just a few classes, like the ones who have to finish schools, and after this slowly they let the younger students come to school again too.
In the end, I would request all my panelists anything that they deem necessary to share about the virus, about the experience, whatever they want to share regarding the COVID-19, please, they can.
I think 2020 will always be a sort of dividing line with a before and an after, something our kids and our grandkids ask us about. There are so many things in our lives that had always seemed too important to cancel, too set in stone to possibly be changed. And now we know that that's not the case, that almost anything can be set aside overnight, that lives can be put on hold in so many ways when something like this happens. I think we will look back on 2020 as this kind of black hole. This year, nothing happened. And also this year, it all happened when we shifted our views on a personal level and on a national and global level of what and who is really essential and what we can't ever take for granted again. Looking back on this crazy year, I know that I will always be grateful that I had the privilege of working for an organization doing this work during this time, and that I had a chance to do at least one small thing every day that helped to address the situation, as there were times when I personally felt so powerless in every other way. It feels like you can never possibly do enough.
I think it's important to share. And I like to reinforce the opportunity of this pandemic gave to the world to change. To think about sustainability, every one of us have the responsibility to care and concern with more responsibility. for the big to the small companies, it's urgent to rethink the way we are producing, selling, talking about things. Products, services, the solutions we are providing need to be more inclusive, sustainable, and planet-friendly. Thank you.
Also, though this may be apparent to those who watch this, in the face of the crisis, we can try to postpone rivalries among nations and just focus on solving the problem we face and then get back to fighting each other all over again. And that's all I have to say. Thank you.
I think Corona in general, COVID-19 is a really serious and bad thing for the whole world. For all the people who got sick, who lost their lives, who lost family members, who still suffer from social distancing and staying at home. But I guess to see the positive aspects, suddenly many things were possible, which before all this pandemic, people said, no, that won't work. For example, home teaching. For example, having a whole university semester online. Many administration jobs who worked from home suddenly, and before that they always told, no, that's not possible, we have to go to work, we have to be physical there, we can't do our job on Skype or Zoom or something, and then suddenly they did, and it worked. Of course, everything was different and new, but many things worked. Many things that people before said that won't be possible. And I think it's good that so many people started to help each other. Younger people went grocery shopping for older people who had to stay at home. They had some applications or websites or, I don't know, in the cities, neighborhoods, who started to care for each other. The people were there for each other and tried their best to make the situation better. And me, for myself, I married during Corona. I had my civil marriage. The other one I had to postpone because there were too many people and it wasn't allowed. And we had to marry with the face mask. And it was a really strange and unique experience. And I guess we will always remember this. And even though the situation was crazy, it was a good day in the end. And I just hope that the whole world will be okay soon again. Yeah, and I think we learned a lot of this whole situation. Maybe for the future, things we can still use in the future. And I hope that some humanity aspects will be kept and people will do more for each other and be kind.